And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
And good morning. Welcome to Boomer Life on CIL 650. It's our baby boomer show. Today we're talking about you, your face, your smile, and we have my teeth's best friend in the studio with me. Dr. Ron Zokol. How are you, Ronnie?
Good morning, Tom.
Good to see you.
Nice to be here.
And I want to compliment you on your teeth. They're just shining. I mean, they're so brilliant today. I had to put my sunglasses on.
Well, I brush them regularly.
Do you? That's part of the big secret, isn't it?
Isn't it?
We have some songs. As you know, we like to play dentist kind of songs on the show. And we won't do it just yet, but we have a song all about brushing today that I picked out just for you.
Oh boy!
Now summer's coming. Summer's coming, and people, of course, in the summer, there's things to smile about. But Ron, as you know, some people don't like to smile too much. It's kind of like hiding behind the hand or a fan or a book or whatever. And the reason for that is that in their teeth just doesn't look good.
Well, it's
they
true.
have problems.
Yeah, that's right.
So what do? They come to see you, and then what happens?
Well, you know, when people come in, you bring up a good point, because just recently a gentleman came in and he was kind of pushed into it by his granddaughter.
Really?
Because, you know, she said, what happened to your front teeth, Grandpa? And they were a little bit ragged. They had broken, chipped here and there, a little on the brown side. So he came in looking to do some restorative work and rebuilding those two front teeth. The problem is that there was other issues going on where other teeth were broken, and he's lost what we call a vertical dimension. This is where all the teeth in the mouth are starting to break down, and you start to overclose. And this is one of the things that gives you an aged look.
Okay.
And so our goal there was, well, if we're going to try and help you, if I rebuild those two front teeth, they won't last very long because everything else has to work properly too. And by repairing those so we had a system problem in there. And of course, that's the problem. And if you try and do a little bit here and not do it properly, then it doesn't last very long. We had a long talk about that.
Let's go through the system. So this gentleman came to see you. He had a problem with his front teeth. Obviously, you have to do some other exploratory work to see that this is not your basic problem.
Yeah. Well, for example, it's like if you got a four-legged chair and you decided you want to make one leg a little longer, how does that work for you? Mm-hmm. Well, that happens in the mouth as well. Oh. So sometimes it's not as easy as replacing a couple of teeth here and there if it doesn't work in harmony with everything else. So sometimes we have to take a bigger look at the picture and say, okay, if we do that for you, is there going to be a problem? Is there going to be a consequence? Then we got to take a look and say, well, how can we do that for you now? And then that gets into an awful lot more discussion.
Is that why you folks in your business always go, here, just put a piece of paper in your mouth and go bite, and you're checking the bite, right, to make sure that, and that's a big important...
Well, you do, because if you don't get that right, then you're overloading one or two little teeth here or there, and you can literally cause them to devitalize, maybe fracture, and start breaking things down. And when things break down faster, it becomes more expensive. So by refining the bite, by putting that little paper in there and grinding around to see where the contacts are, what we're doing is distributing the force over a greater surface area so that no single area is getting overloaded. And that distribution of force is what keeps everything stable. So
let's suppose I think, because I'm not a dentist, but I think I have a problem in my mouth. And I don't go to a regular dentist. Obviously, that's why I have this problem in my mouth. Do I need a referral, or could I come directly to your office, Ron?
Oh, you can come directly to our office. Oh, absolutely. Now, and a lot of people, we work with a lot of dentists who refer patients as well. And a lot of people we refer to other general dentists if they don't have a patient. And when people come in for another opinion, or they perceive that what we can do will be of value to them, then we actually will connect with their dentist with their permission, and we will work in harmony with their dentist to help them achieve whatever results they're looking for.
Dental health is very important to one's overall physical well-being. Let's just spend a moment or two and let's talk about, if you don't take care of your teeth, what could happen to the rest of your body?
Well, there's a consequence there, isn't there?
Yeah.
Well, if you think about what happens, food goes in through your mouth into your body, you get the nutrients that come out of the food. If you can't eat your food, or you choose not to because it's sore, or you can't physically do it, then you're really putting a problem on for the rest of your body.
I was in your office once, and this gentleman came out, and you'd just done some work on him, and he said to the receptionist, he says, I'm so happy now, I can eat. He loves to cook, he loves to eat, and he can finally eat. Stuff is not going under his bridge anymore because he had teeth in a day or whatever, and
that's right.
He was happy.
Well, there's the value of implants, because now we can get the teeth off the gum tissue, and they can be eating with more force and more solid. They can actually eat their fibrous vegetables, fresh vegetables that have all the nutrients and such. And that's what the things that keep us healthier.
So if your teeth aren't strong as can be, you bite into that carrot, you might break a tooth.
You can potentially. If you're biting into a carrot and you break a tooth, you got some problems with that tooth.
Well, apparently, from what I hear, and I could be wrong, but I understand that there's something wrong with the tooth. I mean, even eating the soft candy could cause it to break. You just never know.
Well, you know what really happens in most of those cases is the tooth is partially fractured. And when you eat something soft, somebody would say, well, I didn't bite on anything hard. Maybe just a soft piece of bread. Mm-hmm. And what happens is you bite through it. And actually, it's the force you generate between your teeth that is, 7 to 10 times more force than when you are actually biting on food. Yeah. So it goes through the soft food and then cracks, something comes off. And you say, well, it was a soft food. Well, it's because it was soft. If you're eating something that was firmer, you wouldn't be putting the amount of force on it. And things don't break off as much when you're eating soft foods. Mm-hmm. They break off when you're not having any food between your teeth.
Oh, okay. Here, I had a situation once. I had a friend who worked in the broadcast business. We won't give his name, but I suspect he had problems with his front teeth because whenever you'd see this gentleman, he'd always have a piece of gum over the teeth as if he was trying to hide something. So I think there may have been a problem there. What do you think the problem could have been? I know it's you're shooting at stars and picking on a problem, but some of the basic problems people come to see you with are...
Well, it's unlimited, Tom. We had a lady who we're just in the process of helping right now, and she came in and she had a bridge between her front teeth. She had missed one missing tooth, and she had several teeth that this bridge was attached to, but unfortunately they decayed extensively underneath it. Now this bridge is loose. And she was struggling with how is she going to deal with it, what's she going to do. So she ended up putting a piece of gauze actually between the bridge and the gum tissue just to hold the bridge away from the gum and collapse. And I felt so bad for her that she was going through this process. Of course, the first thing we did was got that all out of there, fit her with a partial denture on a temporary basis so that we can now figure out how to get rid of the disease and then how to rehabilitate that area.
That's interesting. People do strange things in their mouth. When I was a young guy, I worked part-time at Safeway. And there was an older guy. I was like maybe 15 or 16. He was probably about 22 at the time. And he'd been to the dentist and he had some procedure done. And back in the old days, and maybe he still do it now, but he'd put a stitch in here, in his gum, front tooth. And a part of the stitch was hanging down. Okay?
Yes.
Now, I worked in the produce department. One day I see this guy. He takes out his knife out of his apron, which has been cutting lettuce and so, and he decides to cut the stitch. I thought, oh, my God, what are you doing?
No, we encourage people not to do that.
I would think. I said I wouldn't be doing that if I were you, but he apparently he's still with us, so I guess he lucked out okay.
Well, you can also cause a little damage if you don't take stitches out correctly.
Interesting.
And a hacksaw or something like that is not appropriate.
When we come back from our commercial break, can we talk, Dr. Zokol, about your clinic and about how wonderful it is that people haven't had the opportunity to go by and see Dr. Ron Zokol? We'll give you the address and the telephone number, but I think you can come by and, number one, you'll treat him to a coffee, right?
That'd be a pleasure.
And one of the best darn views in the city. Mm-hmm. More with Dr. Ron Zokol is coming up on Boomer Life right here in Smooth and Easy CL 650 in just a moment.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at ShannonOaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
Missing teeth? Don't want dentures anymore? Not happy with the way your smile looks? Dr. Ron Zokol can help. As an internationally recognized authority in oral implantology, Dr. Zokol is dedicated to all your dental care needs and can help solve your dental problems and help you achieve optimum oral health. Book your free consultation or learn more at drzokol.com. That's DRZOKOL.com.
We're back. This is Boomer Life on CL 650.
CL You'll wonder where the yellow went when you brush your teeth with Pepsodent. Pepsodent, Pepsodent.
Pepsodent, yeah. Remember those commercials?
Yeah, unfortunately, I do.
Well, you were probably just a little kid when those used to be on TV and radio way back when.
No comment.
Well, I know. Listen, you've been doing this, Ron, for a lot of years. We're not going to ask you how old you are. You have one or two salt and pepper hairs in your head there, but you've been doing this for a while, haven't you?
You're a kind man.
I try to be. It's because you have the equipment there, and yeah, so I had to come and visit you, so I want you to be nice to me. But you've been doing this for quite some time.
I have.
Yeah.
Yes. Okay, plus 40 years.
Plus 40 years?
Yes, no.
That's amazing because you're only 32. Dr. Ron Zokol is our guest this morning on Boomer Life, and you've been 40 plus years, huh? You've been doing this. And it started with his dad, who was a dentist in a small town, and you couldn't get a job as an airline pilot, so you decided to become a specialist in the world of dentistry.
You have great stories.
I make them up as I go along. Well, one thing I know is true. You do wonderful work, and you have lots of very happy clients.
Thank you. And I will say that my father was a dentist up in Kitimat for 10 years up there, and he came down to Vancouver back in the mid-'60s, and he became a prosthodontist, actually, a specialist in Crown and Bridge, and he worked for another 10 years until I graduated, and then we worked for 20 years together.
Let me ask you, so you're a young guy growing up, you're going to grammar school, you're going to high school, you're going to college. Was it your dad that actually made you decide, I think I want to do this, or was it somebody else?
No. Quite the opposite,
Really?
actually.
Oops.
No, quite. When I told my father, I was in second year university. I wasn't sure where I was going to go. And when I was in second year university, I remember going home to Dad and telling him, I think I figured out where I want to go, what I want to do for the rest of my life. And he said, "What's that?" And I said, "Dentistry." And he looked at me and he says, "How'd you come by that choice?"
Well,
in fact, I think, and probably with good intent, he tried to talk me out of it to
Really?
make sure that the reason I was going into dentistry was properly founded, because it's not an easy profession to do unless you're passionate about it and you love it and you become very, very good at it. There are too many people who get into the field who actually don't like it and don't want to be there, and they retire early or they're quite unhappy.
as a prospective patient or client, would you want to go to a person like this?
No, but you
No.
never find that out.
Oh, no, that's true.
They don't say, "I hate dentistry." No, they don't do that. But it is really valuable when you enjoy your work. And I think that's the secret.
Now, if people remember Dr. Zokol from being at a different location, was it Canby Street? 12th and Canby, around there? By City Hall.
12th and Canby in City Square.
The City Square.
For 15 years.
Yeah, but
there.
you've moved. You've made that move a little while ago.
I did. We're now about a year since
Wow.
I made that move, and we're at BC Perio right now.
Which is 777 West Broadway, right?
Is that correct?
Broadway and Willow?
Broadway and Willow on the 5th floor. And we have that other location in Coquitlam that we're in at
that's right.
1175 Johnson Street.
You're very good.
Hey.
You see, you do know where you're going.
I just have it in the back of my mind.
Let me give the phone numbers. I won't put you on the spot. The location in Broadway, 777 West Broadway. The telephone number, if you wanted to call Dr. Zokol on Monday and leave a message for him or maybe have a chat, 604-872-0222. 604-872-0222. If you live in the Tri-Cities area and you're around Coquitlam, the telephone number out there is 604-936-8244. 604-936-8244. Wonderful offices in both Vancouver and Coquitlam. Somebody comes to see you for the very first time. They walk in, maybe if they're early enough, which hope they are, they fill out the forms, they have a cup of coffee. The nurse comes and says, "The doctor will see you now." Actually, "The doctor will see you now." Some hated words. So you go there, you sit down, you go, "Wow, kind of a nice view, kind of a nice place, very nice place." Dr. Zokol comes in, then what happens?
Well, we have a talk.
Okay.
Yeah, and by that time, somebody has taken an X-ray, and we take a CT scan. And this, by the way, is complimentary.
Oh.
So the CT scan is a three-dimensional X-ray so that we can see your whole upper and lower jaw in 3 dimensions on an X-ray viewer, or on a computer screen for that matter. And so as a result of that, we can see far, far more than people who do not have that type of technology available right in their offices. So we can get right down to brass tacks, you might say. And say,
So that gives you a really good picture of what's going on there.
Absolutely it does. So our diagnostic capabilities is stronger, and our treatment potential is stronger because of that technology.
So I come for the very first time. How long do you think you'll have me in that chair for the first consultation?
It could be anywhere from 15 minutes to an hour and a half.
That's not bad.
And really, it really depends on the nature of your problems and what you want to discuss. Because if you have a single tooth that's simple, you fractured, and you need to have the root removed and an implant put in the ground, that's a very, very straightforward process. We can figure that one out in minutes.
What about if I'm the kind of guy that says, I've heard Dr. Zokol on the radio, and I agree 100% with what he's saying. I should be smiling more. My life should be better. But I'm a guy who's 6'6". I weigh about 240 pounds. I'm solid muscle. But I am scared to death of a dentist.
And we see those people.
Yeah.
And from time to time, those are the people who are afraid of dentists and choose not to go in are the people who accumulate a lot more problems. And that takes some significant experience in managing. First of all, helping the person understand and helping them deal with that anxiety, because you don't get rid of that really fast. So that comes over a lifetime, and you can have good dentists after bad ones, and it's still that anxiety doesn't necessarily leave quickly and easily. So part of that is management of that anxiety. The other part is getting them comfortable and having them learn that when you're treated by this particular office, that indeed we can do this and manage and be kind to your anxiety and concerns and keep you stable while we're doing this stuff. So if it doesn't ever hurt and you find that you come in and it doesn't hurt, you're going to be a lot more comfortable the next time you come in.
So with today's modern medicine, Dr. Ron Zokol, you can guarantee me if I come to you that when you're doing whatever it is that you're doing in my mouth, I'm not going to feel it.
You want me to tell you I'm going to guarantee that?
Well, yeah, I know you got some.
Well, I can tell you this, that the great majority of people who go through surgery that come out of my surgical suites have very, very little pain, almost none at all, in about 90 to 95% of cases.
What kind of different situations do you take care of down there?
Wow, very, very extensive. Sometimes we work with some of the most advanced surgical and prosthetic reconstructions because of the type of expertise that's been there, be it mine as a result of 40 years or Dr. Birdie, who's both a specialist in periodontics and prosthodontics, and herself, and the other teams of periodontists at BC Perio. We can handle almost everything that comes in. And those things that we don't do, we have a team of specialists that we refer to help us effect a result that's optimal.
There can't be very much that you don't do down there at BC Perio.
When it comes to surgery, there's not too much we don't do. That's quite right.
And age groups from young ones up to older folks, right?
Usually the limitation for what we do usually puts a person in the very late teens, early 20s at the very earliest. And then it goes straight up into the 80s and 90s for that matter. Majority probably being in the latter 50s and upward.
So summertime is summertime and the living is easy. Next week, next Sunday is summer.
Is it that close already?
Yeah, next Sunday is summer. It's also Father's Day. It's also International Yoga Day, so don't go over the Burn Street Bridge because you know what's going to happen there. It's International Aboriginal Day, so there's a lot going on next Sunday. So I think what we should do is next Sunday make next Sunday official BC Perio Day.
You think that would be a good idea?
I think we should do. We should have like a little party on your deck down there, take people around, show them around.
Well, you're going to talk to Premier Clark about that?
Absolutely, because we're really tight.
Good.
We're really tight. The address in Vancouver, if you want to go down and have a look around, it's just a marvelous place. The people are so friendly down there, they'll take good care of you. It's BC Perio. By the way, on the web, it's bcperio.ca.
Yes.
Okay, bcperio.ca. In Vancouver, the address is 501-777 West Broadway. That's Suite 501-777 West Broadway. Broadway at Willow. The telephone number is 604-872-0222. 604-872-0222. In Coquitlam, it's 250 1175 Johnson Street. And I believe that's at Glen Drive. So it's easy to find. 1175 Johnson Street at Glen Drive. Coquitlam, the telephone number in Coquitlam, 604-936-8244. 604-936-8244. So, Dr. Ron, I've heard about this on the radio. Monday morning I call. How quickly do you think I might be able to get in to see you?
Pretty quickly. We keep time available mainly for people who phone in from the radio stations itself. We recognize that if we come out here and we actually talk and create a bit of a program and some interest, that we at least should have the room available to bring somebody in should they find that they are in an emergency or even an urgent type of situation.
Interesting. So I know some people should be giving you a call on Monday. When we come back, we haven't done this yet on today's program, and we'd like to do it. Can we talk about teeth in a day?
We can.
Okay.
Sure.
We shall. We will. Right after this, on Smooth and Easy, CL 650, it's Tom Lucas with Dr. Ron Zokol.
It's all about the baby boomer lifestyle. Boomer Life on CL 650.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new Medical Magnet Bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
Missing teeth? Tired of your dentures? Not sure which dental solution is right for you? Dr. Bobby Birdie can help. A certified specialist in periodontics and prosthodontics, Dr. Bobby Birdie can show you your options and assist in determining if dental implants, teeth in one day, or implant-supported dentures are right for you. Book your free consultation at bcperio.ca. That's bcperio.ca. Find your dental solution with Dr. Bobby Birdie and Dr. Ron Zokol. bcperio.ca.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at shannonoaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CL 650.
CL 650. The reason
I wish she'd get it over with. She smiles. That's what she's trying to say. She smiles. And the reason why she's smiling is because she's been to BC Perio.
Really?
Yeah. She had paid a visit with Dr. Ron Zolko. He says, hey, I like your teeth. Let me make them look good. I can do that for you in a day. Give you some teeth, right?
We can do that.
And you did that. Mm-hmm. You go to the dentist. I was asking you off air, and the dentist will, of course, look at your teeth, but they also are looking for other things. Saying, when we go to BC Perio, you're doing the same thing, right?
Yes, it's about health as a whole. We just don't come in and say, okay, you got a problem here. We don't look at everything else. We have to look at everything else because if our responsibility is to help keep you healthy, stable. So we have to look at all the soft tissues. We do a periodontal examination. We do a cancer evaluation, which rarely turns up a problem for anybody, but we got to look. We got to just make sure, because in the mouth, if you get a cancer in the mouth, the sooner we catch it, the higher the probability of complete success and recovery.
Interesting.
Yeah. If you let things go in the mouth, it's so vascular, these things can get around and distribute itself throughout the body.
And again, we talked about this earlier in the show, but you deal with all sorts of people. You deal with the brave and the hardy that come in there and sit down. Hi, Dr. Ron. And they open their mouth and you put your foot in there and away you go. But then you have the other guys that come in that won't open their mouth at all. And so you deal with everybody.
Everybody. That's right.
Yeah.
And we got the tough ones.
Do you really?
Yeah, we do. We get the ones that other people have a lot of trouble handling.
You know what? If you're listening to Dr. Ron Zolko right now, you may have a question about your teeth, or maybe your granddad's teeth or your children's teeth. Give Dr. Ron a call. And I'll give you the telephone number. It's 604-280-0650. 604-280-0650. If you can't make it down first thing Monday morning, maybe you can give the good doctor a call right now. If you're calling from outside the local dialing area, it's 1-877-280-0650. That's a toll-free call, 1-877-280-0650. And if you have a question for Dr. Ron Zolko, there's no wrong questions, right?
No, there isn't. And if you have a question in your mind, you may think it's perhaps a little silly, but it's not, because if you have that question, probably there's a bunch of other people who have the same question also.
One of the questions I have, and we've talked about this numerous times, teeth in a day. I said, can it be done? You said,
All the time. We do it all the time, literally. We help people have longer lives, healthier lives, and regain a youthfulness by converting dentures into teeth that are solid. It seems to extend the quality of life significantly, and what's better than longer years with higher quality of life? I mean, that's what this stuff does. It's amazing.
You might deal with somebody like maybe our grandparents that have had the old wooden teeth since George Washington was a boy. What do you tell folks if they say, I've got a bridge, I'm okay?
Yeah, and that's fine. And if you're happy with that, that's okay. But what we do know is that if you have a bridge, now bridges we understand, it comes in two forms, one removable, one fixed. The fixed bridge usually sits on teeth, on other teeth, and you can do fine with those things. It's just that you're putting extra load onto teeth that weren't designed to take it, and they will have to be repaired. And we see that some of those fail, and you start to lose more and more teeth. By putting implants in, we stop that process from deterioration quite nicely. If you have a partial denture, or you're missing a bunch of teeth and such, we know that the quality of your ability to eat and chew your food properly and to be satisfied from a quality of life and how you look and how you get along with other people, we're going to make it better.
We've talked about this too. I thought the dental implants were dozens of years.
True. It's true. The modern implant, which is lasting potentially for a lifetime, is what's different than the older implants, because we're not talking that many years ago, we go back 40, 50 years ago, the life expectancy of an implant, 50% failure in 5 years.
Wow.
That was the success rate that was deemed to be appropriate. Well, where we have gone in implant dentistry right now is such that when we put an implant in and the tissues around that area are healthy and the implant is healthy and you keep it clean, you can have it for the rest of your life.
If I'm worried about somebody in my family, can I grab them by the scruff of the neck and drag them down to your office?
Yeah, that's happened more times than once,
really?
too.
Let me guess. And it's usually a woman dragging some guy down there, right?
Boy, you know that to be
Why?
true.
Why is it? Why do women actually don't mind going to the doctor, but guys like us, well, you're different. You're a doctor, but guys like us don't like going.
Well, it seems to be I don't know, what is it called, the male concept?
I think so. I went to my dentist once, and dentist I don't mind. Because I keep saying, well, you're not a doctor. I know you're a doctor, but to me, you're a dentist, and that makes it easier for me. It's the other guys I'm not too sure of. So the dentist was giving me something once and to relax me. And I said, just a second. I said, if I start having a heart attack, are you going to know? And he says, oh, yeah. I said,
sure.
Would you have something to help? He says, oh, yeah. So, all right, go for it then. What the heck, right? So there's a lot of things that you folks can use to make people feel more comfortable.
Yeah, we do. And pharmacology is one of those things. With the right training, the dentist is allowed to use IV sedation, which can put a person to a state of sedation where, they're a little bit out of it, and they don't really, if they feel or sense anything, they don't care. Yeah. Because of the state of the mind. And of course, a lot of people can get a lot of things done under those circumstances. And you can take a pill and get the same result, but not as deep, and something that blows off a little faster. So there are various degrees to which we can use the medications to help people who have that anxiety issue.
And there are some people that come in, they just open their mouth and away you go.
Most of them do.
Yeah.
And they get a confidence as well when they realize that once you've had the anesthetic, I'm talking local anesthetic, that there's no more pain, that you can enjoy the environment around you literally without worrying about it, because you become confident with the people who are working with you that they're not going to hurt you.
Yeah, what you're saying is so true, and I'm glad you brought that up, because if you go to the dentist for the first time, you go down and see Dr. Ron Zokol at BC Perry, you may be a little nervous the first time. You sit in the chair, and as Dr. Ron was saying, you'll have a chat, blah, 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 take care of you. The second or third time you go, you're totally relaxed. You're looking out the window, and you're saying, open your mouth. Huh? What? Oh, you're here. Because you have a beautiful office. You got a great view.
Yeah.
You've got wonderful people to take care of you.
We got a great team. The ladies at BC Perry are spectacular. Just incredible people to work with.
I think it's great. I think it's great that the doctors there are wonderful people. The nurses there, the receptionists are wonderful people. But what I like most of all is the way that your clients come out and they're all so happy.
Well, that's what we want to do.
That's what it's all about, right?
Is. Yeah, really. If we can affect the work we do with ease and consistency, and the quality is good, and the function is there, and the aesthetics are there, and all lasts a long time, what's not to smile about?
I know that I don't need a referral to come and see you. I could call you myself, but let's supposing that I haven't been to the dentist for a while. And I know my teeth aren't the greatest, and I'm kind of embarrassed to see you. What do you think I should do?
I think you should come in. We see people all the time, just like you. You think you're the only person who feels uncomfortable about how they look? Not at all.
Really?
Not at all. It's amazing how many people just get enough fortitude to pick up the phone, give us a call, and you'll find that we'll have a solution for you in one fashion or another.
I'll bet you it's mostly women who care what you look like, right?
No,
really?
Not at all.
Really?
I haven't met too many men who haven't been to some degree important that they're looking good by the time treatment's finished.
Such a price vanity, huh?
Yeah, we all have it to some degree. It's amazing. People in their 90s, for example, will come in, and they might be in a managed care facility, and there's other people around. They're still social people, but they want to look good.
You told me this story about this elderly gentleman you had to come in and see you. You fixed him up. He went on a cruise and found some girl who was in her 20s or something. Okay, I made that last part up, but you gave him a whole new life.
Now I have had a fine lady come in and get her work done, all on 4 upper and lowers, and she was in her mid-40s who ended up marrying a young man 20 years her junior.
I was trying to protect her there, and
no names.
That's good.
No names, but it's true.
I tried to get a name out of you one time, and I understand the doctor-patient confidentiality thing, but I know that you've worked on some celebrities, you worked on some sports stars. Tell me about the sports stars. Is it mostly pucks in the mouth?
A lot of them.
Eh?
Yeah, and when it comes to sports-related injuries, the hockey is one of the big ones. Defensemen, specifically.
Canucks?
Yes.
Any other teams?
Yes.
Yeah? Okay. Yeah. Okay. In our division? And I know that, too, that you also do work for the Stars. You've done some work down in the States. You've taken care of some pretty famous, high-profile people.
Especially during the time when Vancouver is such a prominent, the Hollywood of the North.
Mm-hmm.
And I had a lot of people come in the acting world and who are from the L.A. area who had work done.
Have you worked on L.A.?
I've actually worked. No, I don't work in L.A. at all.
No, you never have.
No, I never have. And all my licensure has been here in British Columbia for dentistry. Oh, that's not completely true because I can get Ontario and Quebec, but in Canada, let me say.
Well, then maybe these celebrities are just listening to you and I on the replay, and they're thinking, next time I'm in Vancouver, I'm going to go see Dr. Ron Zokol.
Well, I think it's the referral. What happens is somebody has a beautiful mouth, and they say, "Gosh, that looks really, really nice. Where'd you get that done?" They give a name out, and all of a sudden you find yourself with a referral. And then you get a nice result for that person, and they talk it up a bit.
And they tell their friends, and their friends tell their friends, and they smile at each other.
That's right. I'm
glad you brought that up because we're not all rich and famous. We're not all famous hockey stars or what have you. And we go to see Dr. Ron and BC Perio, and you do your initial consultation. You do the CAT scan. You can tell me what's wrong, and then at the end of the day, you can tell me exactly what it's going to cost. And I go, oh, gee, man, it's a lot of dough. I can't afford that. What happens?
Well, we talk about what can be afforded, and the unfortunate thing is that good quality dentistry is rarely cheap, and that's just a real truth. There are ranges of treatments, though, that can be done, and you don't always have to get it done all at once. And usually there can be a stepping stone to an ideal situation. So the first step of the process is let's get you healthy and stable. Then we can consider how we can rebuild it. And if we have to do that slowly over a number of years, that's fine. If the possibility of getting it rebuilt the way you'd ideally like it is absolutely not going to happen, then we have to find another solution to give you a result that will improve the quality of your life and still keep you healthy without breaking the bank for you.
Do you and BC Perio work with people that have dental plans?
Yes.
Insurance, you do?
Sure we do.
And for people that do not have those, they could sort of make pay-as-you-go kind of thing?
Oh, yeah. We help people with their financing and see if we can get something done. Unfortunately, as I said before, it's not inexpensive, but we will help.
And the reason why it's not inexpensive, too, is that from what I see, being a novice at this, is that, the doctors you go to have lots of expenses. And it's not exactly cheap on your end either.
No, when you think about it, and you think about the high technology, in order to do fine work, the technology has to be there. That technology is hundreds of thousands of dollars. And that's just a reality. That's the cost of doing business in dentistry. But unfortunately, it pumps the cost up.
Yeah.
And there's a fairly large expense ticket to cover every month as well.
So if you'll pardon the pun, you'll try to take the bite out of it if you can for them, right? Dr. Ron Zokol is our guest on Boomer Life this morning. He's one of the great guys you'll find down at BC Perio. If there's something wrong in your mouth, Dr. Ron can take care of it. It's not the way to say it, Tom, but you can take care of it. I know you can. You're a good guy and you know your business. The address in Vancouver is 501-777 West Broadway. That's 501-777 West Broadway at Willow. The telephone number is 604-872-0222. Give him a call Monday. Say you heard Dr. Ron Zokol on the radio, 604-872-0222. Doesn't matter how old you are, you can take care of everybody, right?
Almost.
Within reason. If it's a babe in arms, that's a different story because they just don't have teeth yet. If you're in Coquitlam, it's 250 1175 Johnson Street at Glen Drive. So it's 1175 Suite 250 Johnson Street, and it's at Glen Drive. The telephone number is 604-936-8244, 604-936-8244. And we have more coming up on Boomer Life with Dr. Ron Zokol right after this.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
Missing teeth? Don't want dentures anymore? Not happy with the way your smile looks? Dr. Ron Zokol can help. As an internationally recognized authority in oral implantology, Dr. Zokol is dedicated to all your dental care needs and can help solve your dental problems and help you achieve optimum oral health. Book your free consultation or learn more at drzokol.com. That's DRZOKOL.com.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at shannonOaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
We're back. This is Boomer Life on CL 650.
CL 650. Took my soul to tobacco. 'Cause your mama chewed tobacco. If your mama chewed tobacco, say, took my soul to tobacco.
If your mama chaws tobacco, people don't chew tobacco anymore, do they, Dr. Ron?
Oh, absolutely.
Do they?
Unfortunately.
Really?
Do you know sports athletes particularly?
Yeah?
Yeah.
Baseball players.
Yeah.
So now they come to see you. They've had a little plug of something in their cheek before they come to see Dr. Ron. The first thing you said is, here, try this, the mouthwash, right?
Well, you bring up an interesting point here, because this subject of chewing tobacco is such. Now, we know that when people use chewing tobacco, they tend to stick it in the same place in their mouth all the time.
Oh, okay.
That irritation regularly causes cancer. And that's one of the things. So we know that somebody happens to have a chewing tobacco habit. We're taking a good look. So damage to the tissue. We know that the nicotine in that area percolates through the gum tissue. If you're having any type of work done in that area, can damage the bone structure around that area. This is not a good habit. So it's something that we would always encourage somebody to get rid of.
You see on cigarette packages, they show the people's teeth, and people's teeth look terrible. I would imagine that must be true.
I think that's probably true in a lot of cases. And tobacco stains are for smokers, particularly for people who are hardcore heavy smokers, and if their hygiene isn't very good, their teeth can get pretty ugly.
So if you're a young person listening to the show today, do your best, stay off it. What about those new e-cigarettes? Does that cause any problem? Do we not know yet?
Yeah, there's some issues with that as well. Yeah,
Yeah.
and it's not just, oh my gosh, let's go to an e-cigarette and we're in good shape. It depends what you put into the e-cigarette that can cause some issues for you. But even those are being restricted right now for people.
Interesting. Now, if I go to see Dr. Ron Zokol at BC Perio, and I know at the beginning you have me fill out a form with my medical history, and that's very important because I guess you want to know what kind of, what's wrong with me and what drugs I'm on.
Well, sure. Your head and your mouth are connected to the rest of your body. So if you, at least I hope so.
I hope so.
So what goes on in the rest of your body has an influence in the mouth, and vice versa. So if you happen to be diabetic, for example, we need to know that. If you're on a bunch of medications that are changing how your body responds to certain different circumstances, or even medications that we might provide, we need to know that in advance as well. Our goal is to keep you healthy. And every now and then we'll find that we need to actually have a chat with your physician just to make sure that whatever we're going to do is not going to negatively impact your overall health.
You said you chat with our physician. You also, if we have a regular dentist and we're coming to you for extra special care, that sometimes you will talk to my regular dentist to sort of compare notes and find out what's going on?
Absolutely. We will. Yeah, Yeah, and your regular dentist is really the hub of your care, and we're not there to cause a problem with you.
Right.
So I need to know what's in your regular dentist's head as well to understand where you're going with this and what the goals are. Normally, those dentists there listen to what we have to say and alter or amend perhaps how their approach is based on the things that we can give them, information we can give them about what our findings are.
So a referral from a local dentist is not necessarily needed, but if I do choose myself to come and see Dr. Ron Zokol, and I said I do have a regular dentist, you would talk to that person for me?
Oh, absolutely will. Yeah.
So I don't have to feel badly that I went behind their back and went to see you.
No, and gosh, and the last thing we want to do is embarrass our patients, and we certainly don't want to make them feel uncomfortable. The fact that one is seeking an advanced opinion is not a wrong thing. We don't want to put a barrier in the way of that ever happening. And so our goal is to help you understand what you're looking for, understand the nature of the problem, and give you options for solutions. And then you can do that in harmony with your dentist or not, depending on your preference and such. We will work with you to figure out what's best for you.
And in the course of action, I guess you have a follow-up plan too with your patients? You've done the
yes,
work. And then,
absolutely.
Yeah?
Yeah. And there's some people who have a regular dentist. We encourage them to stay with their regular hygiene program and maintenance program, even though they're with care with us. And then once we're finished, we write letters and send information back to the regular dentist advising them what we're doing. And so they have their log of information, so they're up to date as to what's happening with you as well.
We always talk about brushing your teeth. You say brushing your teeth is very, very, very important. Let me put you on the spot here. If you don't want to answer, I understand. What would you suggest? An electric kind of toothbrush or a manual? Does it make a difference? As long as you use it, I guess.
See, that question's been posed an awful lot over the years. And my regular answer is I really don't care if you use a whisk broom or not, as long as you get the job done. And that's rather glib and flippant. But the point is, more than anything, it's more important as to how you use as to what you use. So somebody who uses a very efficient and effective toothbrush, an electric toothbrush, may not use it properly and won't be as good as a manual toothbrush.
Okay.
But if you are using an instrument like a toothbrush and it's electric and you're doing a good job, you'll probably get the best result.
Soft bristles, hard bristles, does it make a difference?
Yeah, soft. Hard bristles can damage tissue, can damage tooth structure, soft tissue as well. So I'd rather it's a soft toothbrush that you get in everywhere and clean around the gums and the teeth.
So if somebody is brushing incorrectly, that can cause problems too.
You can damage
tissue.
That.
What can you do?
Well, sure, you can cause gum recessions. Things like that. If the gum tissue around a tooth is very, very fragile and very thin, you can damage that tissue by excessively aggressive brushing. If the tissue is high quality, and this is one of the things we do, we take that tissue, we'll actually improve the quality of that tissue for you so you can be more aggressive with your toothbrushing without a negative consequence.
It's interesting. Years ago, I was doing a morning show, and I was talking to a dentist in the States. So my producer had the sound effects of someone brushing their teeth and with the water going. And I said, "What do you think, doctor?" He says, the first thing out of his mouth, he says, "You're brushing your teeth too hard." So can you tell just by looking?
Sometimes.
Yeah?
Sometimes. And sometimes the effect of heavy brushing with a improper brushing technique can cause erosion of the tooth structure. And sometimes we get that confused with the fact that somebody's got an aggressively hard bite, side-to-side bite, and they're causing crevicing. We call that cervical abfraction. Not that word is important, but the important thing is that it causes notching of the tooth structure. And so we have to differentiate that between that and brushing improperly. But by and large, we can tell if you're doing a reasonably decent job. The irony is that some people who are excessively aggressive, trying to be too good, or trying to be really good at their hygiene, are actually causing themselves some damage. We got to dial it back a wee bit and give them better toothbrushes or things that don't hurt them so much.
Or the other thing is, don't be a person who does not brush your teeth for 3 years and the day you have a dentist appointment, brush them because the good doctor knows.
Yeah, we know. We can tell.
You can tell. You're not fooling anybody.
No, not at all. In order for you to mask, you got to be doing it for several months properly before it can snow us a little bit. We can pretty much see what's going on.
If somebody comes to see you, let's say one day next week, you discover they have a problem that's not that serious, would you be able to take care of them and have them on their way and smiling by the time summer is in full swing?
Oh, I think so.
Yeah?
Yeah. And a lot depends on what type of nature of the work that has to be done to get them back to health. But even the temporary teeth that we would use if we have to do some surgical procedure, some advanced restorative work, even the temporary stuff that we have usually is an awful lot better looking and more functional than what was there before.
You always see pictures of family pictures. They're in the backyard. They're at a barbecue. There's always somebody hiding either behind a book or a flower or something, and there's something wrong in their mouth, right?
Well, when people are aware of how poor their smile is, they tend to mask it, and in doing so, they tell us in a big, very, very loud way of the problem.
And there's nothing to be embarrassed about.
I don't think that these people see it that way.
No.
But the truth of the matter is that when you recognize the issue, getting help is probably the fastest way. And the sooner you do it, the less expensive it's going to be and the less time consuming it's going to be. So get onto it. Just go do it. If you got an issue and a problem, get it underway.
What I like about you and all the other good doctors down there at BC Perio is that you're not judgmental.
Can't be.
I guess not.
Well, we know and we understand, but we don't point fingers and tell you that look how you shouldn't have done this and you're doing. No. Our responsibility is to let you know where you're at and what's going to take to help.
Does my lifestyle make any difference to you when it comes to taking care of teeth?
Oh, for sure.
Does it?
Oh, absolutely it does. If you're in a vigorous job and you get your blood pressure up and heart rate up in course of what you're doing, and we're doing surgery, we want you to take a break for a week.
Really?
Oh, yeah, because we don't want our surgery compromised, and you don't want it compromised either, by doing something that's going to cause complications in the surgery.
Could people come to visit you without having somebody to drive the car after? I guess it just depends on what they're having done.
Yeah, sure. If they're having sedation done,
yeah,
you're not driving.
No kidding.
There's no way we're going to let you do that. On the other hand, if you're just having a local anesthetic, it's not an issue.
Then I can just thank you very much, get in the car and drive to wherever I need to go.
Pretty much.
That's right. So you know where you're going Monday. You're going to the Vancouver location Monday?
Yes.
Yeah, she'll be in the office, and the office address is 777 West Broadway, Suite 501 West Broadway, 777 West Broadway, Willow. And if you want to call Dr. Zokol at BC Perio on Monday, or you can call, I guess you can call now, leave a message if they wanted to.
Of course.
Why not? 604-872-0222. That's the local number in Vancouver, 604-872-0222. If you're in the Tri-Cities area in Coquitlam, it's number 250, 1175 Johnson Street at Glen Drive, 1175 Johnson Street at Glen Drive. The telephone number in Coquitlam is 604-936-8244, 604-936-8244. Our guest this morning on the radio, nice gentleman, knows his business. He's been doing this for a few years anyway. Dr. Ron Zokol of BC Perio. We have more coming up right after this.
It's all about the baby boomer lifestyle. Boomer Life on CL 650.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at shannonoaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
Missing teeth? Tired of your dentures? Not sure which dental solution is right for you? Dr. Bobby Birdie can help. A certified specialist in periodontics and prosthodontics, Dr. Bobby Birdie can show you your options and assist in determining if dental implants, teeth in one day, or implant-supported dentures are right for you. Book your free consultation at bcperio.ca. That's bcperio.ca. Find your dental solution with Dr. Bobby Birdie and Dr. Ron Zokol. bcperio.ca.
We're back. This is Boomer Life on CL 650.
CL 650. You've got a mouth full of diamonds and a pocket full of secrets.
Must be Mick Jagger has a mouthful of diamonds. Do you ever anybody come in like that? Can you put an emerald in my tooth here?
The answer is simply yes.
Have you really?
Yes.
I can't see why people would want to do that.
Nor can I.
No? But
And
what the heck,
The funny thing is, my sister had one placed in her
No.
mouth. Yep.
Your sister.
My sister.
And she has dentists in the family. Isn't she a doctor herself?
She is a dentist as well. This one drives me nuts.
Well, here's a quick fact here. It says that women smile more than men, and here's why. Number one, because they're married to men. Gives them something to laugh about, right? Holy cow. So I guess you're seeing more women than men in your office. Or how is your practice? 50-50?
Yes, I put maybe women to the small advantage there. Maybe it's a little bit more women's side than men's, but it's close to 50-50.
I guess it's because the woman has no choice. She comes into this life, and especially if she is the oldest female child, she becomes the caregiver of the family for mom and dad and for her own family. And
well, she does.
And when she says you're going to the dentist, you're going to the dentist.
Yeah, she's a gatekeeper of health in the family.
Oh, gee whizzikers. There's so many problems out there that could be happening. You try to stay healthy, you try to do this, you try to do all the right things, but sometimes things go wrong in your mouth.
Well, you use it so much, use that mouth so much for heavy loads, biting and chewing. And sometimes when you're busy doing something else, you unconsciously clench your teeth and grind them hard. And those are some of the most destructive forces. So a lot of the people who have a severe deterioration of their dentition, all their teeth, usually are people who are very focused, they're business related or something like that. They're really working hard and they put a massive amount of force on the teeth and they chip them and break them. And every time they do this, something's deteriorated and something goes wrong. One little big thing goes wrong with one tooth there, and they come back. It's like that gentleman we first talked about when we started the show. We come to repair one, and we realize that all of them are in tough shape, and now you're looking at a sizable project to really get back to square one.
So it starts, number one, with taking care of them. Go see the dentist, every 3 months nowadays, they say?
I don't think that 3 months is necessary. I think once every 6 months is just fine.
Okay.
Once every 3 months for people who have some type of a significant problem and you're trying to get on top of it, and so you want quicker routine. So somebody with advanced periodontal disease, you might see them every 3 months for cleanings. People who are periodontally sound and stable, got a lot of bone around all the teeth or implants and the gum tissue is healthy, those people don't need to be seen every 3 months.
And let's point out, too, to our listening audience that your practice, you're not just a regular dentist. So I don't go to you for a filling. I mean, I could if it was part of the process, but I just don't go to see you just for a filling. I would go to my regular person and then come and see you for other things, right?
Well, in fact, if you need a regular filling, we'd refer you to general dentist.
Would you?
Yes.
Okay.
So that's one of the things we don't do. So we don't do root canals, but we work arm in arm, if you will, with another dentist specialist and do root canals, or a lot of general dentists do their own root canals. So we work with people who do these. Orthodontics, for example, we don't do orthodontics at BC Perio. What we will refer to an orthodontist and work hand in hand with that orthodontist in developing a final result that meets our goals.
If somebody comes in, let's say they're a teenager and we call them railroad tracks, but they had the braces in their mouth?
Yes.
Can you still work on them, or do they need just to go to the person that put the railroad tracks in there?
It really depends on what we're trying to accomplish, but when people are actively involved in orthodontic movement, and there's a lot of different ways that that's happening today, we could be using the same railroad tracks that you talked about where things are bonded to the tooth structure and you have this wire that goes around the front of the teeth. Sometimes you can put that wire in behind the teeth, and there's that way. There's another one. There's called Invisalign, which you can now move teeth around by just pushing them gently with these appliances that you wear instead of putting these brackets on. So there's a lot of things that we can do. So depending on the nature of your orthodontics, depending on the nature of your needs, both whether it be surgical or prosthetic, we can work together hand in hand. Every now and then, if we have to go work in there, we may get the orthodontist to remove that arch wire that they put in so we can have access, and then you go back in and put it on again.
I won't give you the doctor's name, but it's down by your office. Both my daughters, back in 1986 Expo year, both had the braces. Yeah. They also had the headgear. So it looked like a little antenna. So people go, hey, and what planet are you from, little girl? Yeah, what station do you get on there? I get CL 650, sir. So, but those things are important, right? They can, and they have beautiful smiles now.
Oh, they do, yeah. And that's changing a lot, because what we do in implantology is that we actually place these little, what we call is temporary implants, anchorage devices, TADs they call them, and they help because that head site that you talked about before, we've gotten rid of that for the most part, because we put these little implants in that you can wire against the implants and pull teeth here and push them there.
Wow.
Anchoring from the implants rather than the back of the head.
Let me ask you this question, and if you don't have an answer, I understand, but we've seen so many changes in dentistry and what you do over the years. Where do you think it's going to go in the future?
Oh, good Lord.
What do you think we'll be able to accomplish that we can't accomplish now?
I think one of the things that if we can ever get a handle on it is how to develop a periodontal ligament from an implant to bone structure, thereby making an implant function more like a natural tooth when it's in there. When that happens and when that can be made to occur, then we're going to see a simplification of the reconstructive process and how force is managed with dental implants. That might be the next huge one. Whether that's reasonable to expect in the next 10, 20, 30 years, I have no idea for sure.
Would that take the place of growing somebody's bone, or would that just add to it? Or
no, it wouldn't. It would. You're still going to have to regenerate the bone that's been lost. But when you put the implant in, right now the implant has an intimate relationship with the bone structure. But a root of a tooth, is supported by very, very fine ligaments between the root of the tooth and the bone structure. So when you put force on it, that ligament absorbs some of the force, and therefore it buffers, if you will, the force. Whereas in implants, there's no buffering of that force, and you get more force actually paced into the bone structure when you bite on it. It's a much more rigid structure. It's one of the reasons that teeth will break on top of an implant more than they'll break on top of a tooth.
Interesting. Now, summer is here, as we know. Next Sunday, people get together. Give me a reason why I might want to come and visit you at BC Perio. It's summertime. The living is easy. You're going to be smiling a lot, right?
Well, anytime you have a sense that your smile can be improved and it bothers you to any degree at all, come and get it checked out. As a matter of fact, it's pretty much gratuitous.
Well, let me say, information is knowledge, right?
Armed with the information, you now know what you can or cannot do. And it's still your choice as to whether you do something. Getting the information is really where you want to start.
Of course, then there are guys like me who sometimes say to the doctor, no, that's enough information. I don't need any more. But you I like. You I'd trust. No, seriously, folks, if you're looking for a fellow that's going to take care of you, Dr. Ron Zokol, you've been practicing dentistry and what you do now for, we won't say how many years, but more than 10.
Yes.
More than 20. Maybe a little more than 30. But we won't go much more than 40. But you're a good guy. You're fun to know. You know your business. We've seen you at work. And man, oh man, you are really an impressive guy.
Thank you.
Yeah. And I like your outfit today. You didn't wear the doctor's suit this time. That's good. So what's on your agenda for the rest of the week?
Oh, we got work. We got a bunch of doctors coming in for next weekend training.
Really?
We teach them how to do surgery and using implants and such. So we got people coming from North America, from various parts of the U.S. and Canada, and they're coming into Vancouver, and we're teaching them Friday, Saturday, and Sunday. It's one of our regular programs for them.
You get doctors and dentists from all around the world that come for some education. You get clients and patients that come from all around the world. But you still have time for the local guys, eh?
Got to.
All right. Let's give that telephone number again. In Vancouver, it's 604-872-0222. 604-872-0222. The address is 501-777 West Broadway, 777 West Broadway at Willow. Very easy to find. If you're in the Tri-Cities area in Coquitlam, the address is 1175, that's Suite 250, 1175 Johnson Street at Glen Drive. And in Coquitlam, the telephone number is 604-936-8244. Coquitlam again, 604-936-8244. Or you can get some more information online if you go to the website, which is bcperio, perio.ca.
Correct.
Fantastic. Thank you for coming by.
A pleasure to be
I
with
always
you.
look forward to when you come by. It's great.
Oh, thanks
I think
so
I'll
much.
come and visit you in the office. I don't have to have any work done, but I can maybe just hang out with you for a while. What do you think? I'll call you next week.
I'll set some time for us.
Ron, you have a great weekend, and happy Father's Day for next week.
Thank you. And
Are you
as
a dad?
well.
I forgot to ask.
I am. 3 sons.
Oh, that you know of. Okay, just kidding. It's a bad joke. You have 3 wonderful sons. They're all grown up now and in dentistry?
No.
No.
Well, one's on the sideline of dentistry, and he's working with me at the BC Perio. And the
Wow.
institute that we train other doctors at, he's helping out. He's got a business degree, so he's helping out the administration and the growth.
Wonderful. Listen, you have a great weekend.
Thank you, Tom.
Have a wonderful week. Have a great summer, and I'll talk to you soon.
You bet.
It's Tom Lucas with Dr. Ron Zokol for BC Perio, and you've been listening to Boomer Life on Smooth and Easy, CIL 650.